Hello, I am Dr. Emily Carter, a heart surgeon. And for more than 15 years, my life has taken place inside an operating room repairing hearts. But today I want to talk to you about something I see outside the surgery room, something that deeply worries me. It is a warning about a danger hidden in plain sight, very likely inside your own medicine cabinet. I have seen the devastating consequences of medications that a huge part of the adult population consumes, believing they are as harmless as a piece of candy. People take them for pain, heartburn, or just a simple cold. But the reality I see in my patients is that some of these drugs, far from helping, could be silently weakening the most vital muscle we have, the heart. I'm not talking about strange treatments or experimental drugs. I am talking about over the counter painkillers, stomach protectors that many people take every morning, and simple decongestants. Scientific evidence and my own clinical experience show a worrying picture. Without knowing it, many people over the age of 60 are increasing their risk of suffering from serious heart problems. My goal today is not to scare you, quite the opposite. It is to give you clarity, to give you the knowledge you need to protect yourself and take control of your health. Because the real danger is not the disease itself, but the lack of information about the risks we face. Now, let's break down the 5 types of common medications that pose a risk to heart health in older adults. I will explain why they are dangerous, how they act, and most importantly, what you can do about them. Stay with me because this information could literally save your life or the life of someone you love. Let's start with the most common group of medications found in almost every home: non-steroidal anti-inflammatory drugs, also known as NSAIDs. Names like ibuprofen, naproxen, or diclofenac are probably familiar. They are our first choice for a headache, backache, or arthritis pain. They work, no doubt, but using them without control, especially if you are over 60 or have heart problems, is like playing Russian roulette. For years, the medical community has known that these seemingly harmless pills have a dark side. The US FDA itself, back in 2005, required clear warnings about the risk of heart attacks and strokes. Let me share the case of Roberto, a 72-year-old patient of mine who loved gardening. He suffered from arthritis in his knees, and to calm the pain, he took diclofenac almost daily. One day, while caring for his roses, he felt exhausted, short of breath, and his ankles had swollen to twice their size. At the emergency room, we discovered he was suffering from acute heart failure. His heart, which was already working harder due to age and mild hypertension, simply could not take it anymore. The trigger wasn't a new heart problem. It was the continuous use of that harmless anti-inflammatory. But how can something so common be so dangerous? The mechanism is subtle. NSAIDs block certain enzymes to reduce inflammation, but in doing so, they also interfere with substances that protect our kidneys and blood vessels. This creates 2 disastrous effects. First, they make the body retain salt and water. Imagine your heart as a pump. If suddenly there is much more fluid in the pipes, the pump has to work overtime. A young heart can handle it, but one already stiff with age or struggling against high blood pressure can fail, just like Roberto's. Second, NSAIDs can constrict blood vessels and raise blood pressure. Even if you are not hypertensive, regular use can elevate it. And if you already take blood pressure medication, NSAIDs can cancel out its effect, silently driving your pressure higher. It is vital to understand that the risk depends on the dose and duration. Drugs like diclofenac and ibuprofen at high doses, around 2,400 milligrams per day, are the most strongly linked to problems. Naproxen at low doses seems somewhat safer, but the risk is never zero. And to make matters worse, if you take low-dose aspirin to protect your heart, some NSAIDs, like ibuprofen, can cancel out its protective effect. So, what should you do? The solution is not to simply endure the pain, but to talk with your doctor. Ask, "Doctor, with my medical history, what is the safest option for me?" There are alternatives. Sometimes acetaminophen is enough. Other times, topical anti-inflammatory creams or gels that act locally are a great option. And if an NSAID is absolutely necessary, the golden rule is the lowest effective dose for the shortest possible time. Section 2, the false protector, proton pump inhibitors, PPIs. Now we arrive at number 4, and this one may surprise you because it is known as the stomach protector. I am talking about proton pump inhibitors, or PPIs. Medications like omeprazole, pantoprazole, and lansoprazole. These are some of the best-selling drugs in the world. Millions of people take them every morning, almost like a ritual, either for acid reflux or to protect their stomach from other medications, such as the NSAIDs we just discussed. And here lies the irony. The medication that is supposed to protect you from one risk may actually be creating another behind the scenes. Let me tell you the story of Elena, a 68-year-old woman who was prescribed omeprazole for chronic reflux. She was told to take it for life. Her heartburn disappeared, and she never questioned it again. Years later, during a routine checkup, her electrocardiogram showed something unusual. A blood test revealed the cause. Her magnesium levels were dangerously low. Magnesium is the guardian of the heart's rhythm. When it is lacking, the heart becomes electrically unstable, like an orchestra without a conductor, and dangerous arrhythmias can appear. In Elena's case, the chronic use of omeprazole caused this deficiency. PPIs reduce stomach acid, but that acidity is crucial for absorbing nutrients. When suppressed for too long, magnesium absorption plummets. And the problem doesn't stop there. What worries us even more is that several observational studies have found an association between PPI and an increased risk of heart attack. One theory suggests that these drugs may lower nitric oxide levels, a molecule that keeps our blood vessels flexible. Without it, the vessels stiffen, setting the stage for a heart attack. The causal relationship is still debated, but the association is concerning. In addition, omeprazole can interfere with vital medications like clopidogrel, an antiplatelet drug prescribed after a heart attack. By interfering, it makes the protective drug less effective, leaving the patient vulnerable. The issue is that these medications have been trivialized. They were originally designed for short treatments of 4 to 8 weeks, but they have now become a permanent solution for problems that often could be managed with lifestyle changes. If you have been taking a PPI for months or years, do not stop abruptly. Talk to your doctor. Ask, do I really need this long term? Can we lower the dose? Are there alternatives? And if you must take it chronically, it is essential that your doctor regularly checks your magnesium levels. Before moving on to the next group of drugs, which include some taken for nothing more than a simple cold, I want to take a brief pause. If what you've heard so far has been useful, I ask 2 simple things. First, subscribe to this channel. My mission is to provide clear, no-nonsense health information so you can make the best decisions. Second, and perhaps more important, share this video. Think of your parents, grandparents, and friends. A single click could start a conversation that truly saves a life. Thank you for your support. Now we come to number 3, oral decongestants for colds. These are the ones that contain pseudoephedrine or phenylephrine. They are the magic solution for a stuffy nose that won't let you breathe. But this so-called magic solution can come at a very high cost for your heart, especially if you already have high blood pressure or any heart condition. Marta, a 75-year-old retired teacher, caught a bad cold. To breathe better, she bought a popular cold medicine with pseudoephedrine at the pharmacy. By the second day, she felt her heart racing out of her chest, along with dizziness and a terrible headache. Her son rushed her to the hospital. Her blood pressure was sky high, and she had developed an arrhythmia. That decongestant had pushed her heart to the limit. Why does this happen? Pseudoephedrine and phenylephrine are vasoconstrictors. Their job is to narrow blood vessels. In the nose, that's great because it reduces swelling and clears the airways. But the drug doesn't act only in the nose. It travels throughout the body, narrowing blood vessels everywhere. This creates 2 dangerous effects. First, by narrowing the arteries, the heart has to pump against much greater resistance, like trying to force water through a squeezed hose. Blood pressure spikes, sometimes to dangerous levels. Second, they are stimulants. They make the heart beat faster and less regularly. If your heart is already sensitive, this extra stimulation can destabilize it. Recently, European health agencies have renewed their warnings about pseudoephedrine because of its link to rare but severe syndromes involving blood vessel constriction in the brain. This only highlights how powerful its effect is on the entire body. The big danger with these drugs is that they are sold over the counter. People buy them without reading the fine print and without considering the risks. If you are over 60, and especially if you suffer from high blood pressure or any heart condition, avoid them. There are much safer alternatives: saline sprays, humidifiers, or corticosteroid nasal sprays that work locally. Do not let the quick relief for your nose turn into a life-threatening emergency for your heart. Section 4. The mind-heart connection, certain older antidepressants. Now we reach number 2, a delicate but vital subject: mental health. I am referring to a class of older antidepressants that are still sometimes prescribed, either for depression or for chronic pain. These are the tricyclic antidepressants, names like amitriptyline or imipramine. Depression itself is a risk factor for heart disease, which is why treating it is essential. But how we treat it matters, and these particular drugs can be dangerous for the heart of an older person. Francisco, a 78-year-old man, suffered from terrible foot pain caused by diabetes. His doctor prescribed a low dose of amitriptyline. It did help with his pain, but soon he began to feel dizzy every time he stood up. One day he fainted and fractured his hip. The cause was the amitriptyline, which triggered a sharp drop in blood pressure upon standing, what doctors call orthostatic hypotension. But that is not the only risk. These drugs can also increase the resting heart rate, placing constant stress on an aging heart. Even more concerning, they can interfere with the heart's electrical system by slowing down impulses. This shows up on an electrocardiogram and raises the risk of dangerous ventricular arrhythmias that can even lead to sudden death. Because of these risks, tricyclics are no longer the first choice for treating depression in older adults. Nowadays, newer antidepressants that are safer for the heart are preferred. However, tricyclics are still sometimes prescribed for neuropathic pain. If you or a loved one are taking one of these medications, it is crucial to talk to your doctor. Have safer alternatives been considered? Are blood pressure and heart rhythm being monitored regularly? Mental and physical health go hand in hand. We must make sure that the treatment for one does not harm the other. And now we come to number 1. This is perhaps the most controversial and debated point, but it is my duty to share the concern that exists within the scientific community. I am talking about calcium supplements. Yes, you heard correctly. Those pills that millions of people take daily to protect their bones from osteoporosis. For decades, the message was clear: take calcium to keep your bones strong. But in recent years, more and more studies have questioned the safety of these supplements for the heart. Take the case of Lucia, a 70-year-old woman. Worried about osteoporosis, she began taking a high-dose calcium supplement on her own. Years later, she suffered a heart attack. She did not have the classic risk factors. She didn't smoke. Her cholesterol and blood pressure were normal. Investigating possible causes, her medical team turned their attention to that daily supplement. The controversy is real and the evidence is not conclusive, but the hypothesis is worrying. Calcium from food sources, like dairy products or vegetables, does not appear to be a problem. It is absorbed slowly, and the body uses it effectively. The issue seems to arise with high concentrated doses from supplements. When you swallow a tablet, it creates an artificial spike of calcium in the blood. The body cannot use all of it for the bones, so the excess has to go somewhere. The main concern is that it gets deposited in the walls of the arteries. This process, known as arterial calcification, stiffens the arteries and may contribute to plaque buildup that leads to heart attacks. Large studies have suggested that calcium supplements may modestly increase the risk of heart attack, while other studies have not found this connection. The evidence is complex, and for people with diagnosed osteoporosis, the benefits may outweigh the risks. But the lesson is clear: more is not better. The safest strategy is to get calcium from food. If your doctor believes you truly need a supplement, never start it on your own. It is a medical decision that must carefully weigh both your bone health and your cardiovascular risk. Today, we have uncovered the hidden side of 5 very common types of medications: anti-inflammatories, stomach protectors, decongestants, certain antidepressants, and calcium supplements. My main message is not one of panic, nor am I telling you to stop taking your medications. Doing that on your own would be very dangerous. My message is one of empowerment. You now have valuable information that many people simply do not know.